And so if you're getting bad messages from any of these three areas, the body has to make adjustments to that. Those adjustments are okay if they're temporary, they become permanent, and then they start to cause problems, chronic problems, fatigue problems, headache problems, all the some natural aches and pains that we all suffer from sitting too long. And then we've got one-sided postural strains, especially now using a mouse or sitting at a desk, poor ergonomics and that sort of thing. So when we looked at this, I wanted something that would take away the signals. So when we do what we call a sacral float, you can do a sacral float and allow the body to self-correct in this area. You can use various soft tissue movements to make these joints realign. And the same on the head. But if you could get all three, so as we slowly played with it and worked with some prototypes over the years, we found that if the device could separate what we call the occipital and antil here, let the sacrum float between the two iliac bones here, and separate the talus joint here, it actually switched off the gravity-fed messages in through the nervous system to the brain. And that then allows the body to spontaneously start to go to its alignment. Because a joint will always go back to what we call its natural, neutral or orthostatic position when you take away the factors that are pulling it out of alignment. So if you can neutralise those signals, that allows the body to basically self-correct. So our initial response was that it started to fix the pitch, roll and yaw fall to the head, which allowed for better correction. And now, as I've researched it more, the more you use it, you're getting rid of the postural strains from birth onwards, the postural strains of one-sided sports, the rehabilitation after injury. When you rehabilitate these areas by aligning the spine realign, it really helps promote that. And while you're on there, you can do various things like breath work, you can do other releases. So there's a whole program. I do eye exercises to realign this, release all the jaw and the vagus nerve. So 10 minutes of being on the aligner, doing the procedures that we talk about, in a matter of weeks, you'll start to really feel the benefit. Really feel the benefits. So the craniosacral mechanism is the primary respiratory mechanism of the body. Primary respiratory mechanism. So it's the seat of all breathwork in a sense. That system is what we're trying to align, it's what we're trying to operate to get the cerebrospinal fluid flow to go to all parts of the body. And that is your primary respiratory mechanism. And that operates from the dural system in the head, so that the brain expands between 6 and 12 times a minute. And that pumps the cerebrospinal fluid all the way down. Now there's a diaphragm in the head, there's a diaphragm in the thoracic inlet, which is here. We have our true diaphragm here, and we have a diaphragm at the sacrum. And it's important that all of those diaphragms are free and unrestricted in their work. Now again, when you've got pelvic misalignments or shoulder misalignments or ribcage misalignments, all of that restricts the true diaphragms. So although you breathe in, to get the true nature and the best fulfillment out of breath is to have the whole craniosacral mechanism working correctly with no tension or stress in those particular diaphragms.